I compare empirical treatment with a diagnostic guided target selective treatment. Another study results on field adoption and users experience, how and what Mastitis can enable in practice. And after I finish with conclusions and we take home messages. So why mastitis treatment needs to evolve? There is societal pressure to reduce from regulatory bodies and international that 70% of antibiotic usage is in mastitis management, and current practice, particularly in clinical mastitis treatment, are very empirical. They mostly don't use diagnostics information, so we don't use pathogen information, and we know up to 40% of clinical mastitis don't need antibiotic treatment. So there is an opportunity to shift our approach to a target selective treatment approach to reduce antibiotics and limit them to cases where there are more chances to cure with antibiotics, and withhold the antibiotics in cases where there is high spontaneous cure rates. Okay, so a first study where we compare the empirical treatment versus diagnostic targets selective treatment. This was done in Germany in 7 farms with 7 clinical mastitis samples. Just mild and moderate cases were included, and where we compare real farm treatment decisions versus target selective treatment decisions in terms of antimicrobial usage and compliance with their German antibiotic guidelines. And so what we see, mostly were gram positive, the results, and we see well that here 18% of E. coli and 7.5% of no growth. So meaning that 25% of clinical mastitis will not need antibiotic treatment. So there is a chance or an opportunity to reduce antimicrobial usage. 1 out of 4 cows could immunity could deal with the infection without antibiotic treatment. So there is this highlights an opportunity for antimicrobial reduction. Okay, another important aspect and key findings from the real farm treatment protocols is that in 91% of the treatments, as you can see on the top, were used broad spectrum antibiotics. And as well, another point is that 88% of the treatments in the empirical treatment were from C group from the EMA. So this normally should be used with caution, this type of antibiotics. And the first approach should be normally done with group D, that only 10% of the treatments, as you can see, were only treated with group D. So penicillin, and should be the first line antibiotic approach. And another important aspect from this study is that most of 84% of the treatments exceeded approval duration of intramammary treatment, so were used off-label, and this it highlights a concern in terms of potential for milk failures and milk residues, as the withdrawal period can be different. Okay, and then another important aspect on this studies was that mainly all the gram positives, as you can see, are sensitive to penicillin, except enterococci, and so mostly. And we saw that penicillin-based antibiotics were rarely used. So there is opportunity to shift from this group C to group D antibiotics on treating especially gram-positive mastitis. And you see that, whoops, sorry, apologies, that here for Klebsiella, it's resistant to most of the antibiotics tested. So that's why sometimes it's important to differentiate among the gram-negatives. Do not treat the same as E. coli and Klebsiella, because the chances of cure are not the same, okay? So in conclusion, so real farm treatments or empiric treatments are misaligned with principles. They are often inappropriate treatment selection, very often over-treat, and here highlights as well a concern of off-label treatment that was very commonly reported. And the target selective treatment, as the name says, you target to the specific bacteria, avoids unnecessary treatments, and as well have short duration of treatment. So the other study is a study where was a survey in field adoption and user experience with Mastitis in France. And the aim was to assess how Mastitis is perceived and integrated into veterinary practice and how it is used in dairy farmers in France. And was an online survey in vets and farmers that have Mastitis. And this was done last year from January to May. So the results from veterinary perspective says that the Mastitis is a rewarding in implementing target selective treatment with the use of Mastitis is a rewarding approach, delivers tangible results with a closer follow-up and more tailored treatment decisions. 41% of the farmers observed an increase in treated clinical mastitis cases. 51% saw an increase, because we know that most of the time vets just are called for severe cases. The mild and moderate cases normally are out of the scope of the vet directly. And 51% saw an increase in the use of narrow spectrum antibiotics. So this helps this goes in support with the antimicrobial stewardship guidelines and principles. 54% noted an increase in targeted prescriptions, so supporting what I just said. 48% reported an increase as well in the rate. So this has also an impact on animal health. And from a farmer perspective, farmers say that is a simpler and more controlled herd management approach with clear decisions, so they have more peace of mind. Cows are generally healthier, fewer losses, and they say that they also have more milk in the tank. So this is a very powerful statement for farmers. And 41% reported a decrease in injectable antibiotics, 58% a decrease in intramammary treatments. So with the implementation of TST, a target selective treatment approach, they reduce significantly antimicrobial usage. And 50 report a decrease in the incidence as well of clinical mastitis. 72 reported as well an increase in cure rate. So this is based on perception of users of Mastitis, but supports what I just previously presented in the previous study. So what Mastitis can provide? So Mastitis can identify bacteria, the pathogen, so we can, after implement target selective treatment, as antibiotic sensitivity testing, and can rank the antibiotics that are more likely to cure a specific bacteria that is identified, give you MIC values and report the bacteria in susceptible and resistant categories. And this supports the target selective treatment approach, shifting from empiric treatment. And what else Mastitis can give other than supporting TST. It also can help better mastitis management by sharing, capturing all the data that is available for the historic of the cows. This is captured in a cloud basis in an automatic way. This can help us as well to see herd trend analysis and to implement to the specific farm results, and this in link with somatic cell count and are available in better managing mastitis on the herd in a more holistic way. Okay, so to conclude, routine mastitis treatment is still largely empirical and is variable. This leads to misalignment with pathogen biology and stewardship principles. A diagnostic guided treatment decision enables more targeted, appropriate, and shorter treatments. And as well, this bridges the gap between science, practice, and regulatory pressure to reduce antimicrobial usage. And to finish and to keep in mind, to take home a message, not all mastitis cases require antibiotics. That's a fact. The pathogen must guide the treatment disease. That's why we really need to test using diagnostic tests to know what is the cause of the problem. And current practice, even in Central Europe countries, in developed countries, still lead to over and misusage of antibiotics. TST can improve precision and antimicrobial stewardship, and on-farm diagnostics like master tests can enable better decisions in practice. And we can show you now briefly the master test device.
Where do you want it?
Here.
Yeah, in front of the camera, Bram. Perfect.
Yeah, I can hold.
So the master test, it consists of three things. You have one thing is your lab box tool itself. Inside of it, there are 4 slots. In those slots goes the second part of the master test. That are the cartridges, which will contain your milk sample. And the third part is this system is connected to an online platform, like my colleague said. How it works, very basically, once you collected the milk sample, you shake the sample before you put it in a cartridge, which looks like this. Once it's inside the cartridge, you wait a few seconds, then you pour off the milk, and the resistant milk will stay in a level below. Once you close the cartridge, you can pat on it very firmly so that the milk will go down good. And if there's some air bubbles in it, it will go up. You put it in the cartridge, you put it in the lab box, and then you have all these fancy buttons, but you don't need them. They are for me when I install it. You can choose the four positions on which side you've put on the cartridge. And then after you've done that, you can start the test on the online platform where you can fill in the farmer, the cow, the quarter, the number, and all the information. Once you press start, the system will automatically start. And then within 21 hours and 40 minutes, you will get a result. Now, the result consists of 2 different parts. We have cartridges for clinical mastitis, and we have cartridges for subclinical mastitis. And there's a difference. The clinical mastitis, it can contain 1 or multiple bacteria. And when it's 1 bacteria, it will also provide antibiogram that consists of 6 possible antibiotics. The subclinical cartridge is different. It is divided in 2, so it can do 2 milk samples per cartridge, but it doesn't contain an antibiogram. So you can do more samples but no antibiogram. With the clinical, you can do sampling and antibiogram. And this is all a result within 24 hours. I think is that clear?
And all this information, I repeat, goes to a platform, and you can combine all the information, that historical information that is for this farm. The vet can, if has more clients with master test, can compare pathogen profiles within each farms, so we can adapt different preventive strategies to each farm. And this also provides you reports with all this information that you can share with your farmer and explain what are the real issues with real data. Thank you.
You need to put it like that.
You can put it there. I'm sure they will see. No, thank you very much. Well, just a question for the group. What percentage of farmers that you know take milk samples for culture of all cases of clinical mastitis? Oh, yeah. You do, Annalena.
No, I'm a bit biased maybe, but I come
Okay.
on farms, but they have other health issues, and then
Yeah.
they take sometimes, but it's a really low percentage.
It's a very low percentage. I always ask the question in different countries. In Italy, a couple of months, there was one that raised their hand, but they really have a concept focusing on taking milk samples. They really have transport, logistics. They really focus on it. So, but that's why I like this session. Everybody likes it. Remember Dr. House, even tests. We have sensitivity, we have specificity. But let us first start with trying to find tools to motivate our farmers to take milk samples for their culture. So that's why I also like that all these tools that are available are now presented as well. That brings us to our next speaker, Ben Davidson. I think he wins already the prize for the furthest away from us. He's coming from New Zealand, not only for the MEX ConneXion Event, I think, but welcome, Ben. And I'm happy that you are here again in Belgium. So you will show your tool. So then we will move a bit the master test for now.
That's okay.
Yes. And we will also move the table a bit in front of the camera. Be careful that you don't break the tool.
We'll take that off.
You don't need to like that. You have electricity.
Tell me when to stop.
Yeah, very good. And if you can stand there, it's perfect. Yeah. Okay. You have the micro. Yeah, very good.
Great, thanks, Sophie. Yes, hopefully you can understand my English all the way from New Zealand. This is my third trip up to Belgium, to the conferences up here. Sophie and the team do such a good job, I keep coming back. So today we're going to talk about a case study from New Zealand and a bit about our diagnostic machine. So I'm a veterinarian, been a vet for over 25 years, and I've been running this company called DairySmart for the last 2 years. Right, so this is one of our farms. It's the case study that we're going to talk about. So Medstone Farms. So I guess we've been in the market around 4 years, and this was a case where we had a cell count, bulk milk somatic cell count of 260,000. It is now sitting at 75,000. And their 6-week and calf rate and empty rate have improved, and so has their production. So we'll go through and just talk about how that has happened. And so in terms of the background of the farm, so in New Zealand, it's common for a farm to maybe convert from their sheep and cropping and beef. And this is what this farm did. To get to 1,300 cows, it's unusual to be able to go out and just buy a herd of 1,300. So you select cows from different mobs. And unfortunately, farmers don't always sell their top cows. They keep them in the herd, and sometimes they sell a bit of their shit. So that's their maybe Staph aureus cows, high somatic cell count cows. So that 7-point plan that Sophie put up right on the first slide would have been quite useful. Testing all your cows before you buy them to make sure you're not buying a problem, but that didn't happen in this case. So they bought in their cows. They were going to make lots of money doing their dairy farming, and they ended up with this bulk milk somatic cell count quite consistent through the season, a real headache, treating lots of mastitis, and they were tearing their hair out. They blanket treated the whole herd, and it didn't seem to make a difference. So the following season, they started off quite high again, and it looked like the problem was going to carry on. So the root problem was Staph aureus. So we were culturing, DairySmart came in, and what was found is that, so DairySmart offers a testing system where we go in and we test not only clinical cases, we do a lot of subclinical cases. So in after the first herd test, it was very high. They had this high bulk milk somatic cell count. And so DairySmart came in and tested all those high somatic cell count cows, so anything 100 to 200,000. And they found that over a third of the 260 cows tested were positive for Staph aureus. And what happened is that they dried some cows off, and then they found that 3 of the cows got very sick. And when they went back and cultured those cows, they were Staph aureus, but they had been low somatic cell count cows. So they went in and tested a lot of the low somatic cell count cows, and lo and behold, they found a whole lot more Staph aureus. So Staph aureus, although that trigger of around 200,000, even 100,000, it wasn't picking up every case. So they were continuing. Does that sound familiar? Have you seen cases like that with low somatic cell count and Staph aureus? We've seen Staph aureus medium growths in cows with 16,000 cell count. So this is what we introduced onto the farm. So it's the Jupiter machine. So that's the machine on the right. So that has a digital camera set at a certain focal distance above where the plates go in. And you can see the plates here. We use a chrome agar as well as the blood escalin. So the blood escalin picks up all bacteria. The cream one on the side there is Staph chrome agar. So it's very good at differentiating between NAS and Staph aureus. And then we have the gram-negative chrome agar on the bottom, and the different pathogens shine up like different Christmas tree lights with different colours. So we use the digital camera, and then an AI algorithm has been taught to recognise the different colours. And one of the strengths, I guess, of culture is that we pick up contamination every time. So if there's more than 2 or 3 bacteria on the plate, we will find it and we will see it and we will report it. So that's a really important point, because around 25% of culture samples or milk samples can be contaminated, particularly if farmers aren't used to taking samples. So that's in the literature, it's sitting at around 23%. So that's our plates, and then we have the DairySmart app that you can see there. So that not only talks about the results, but also the next step to take for each of those results. So the action, the farmer gets a result, but then what to do next. So that can help. And then they can look at how many cases they've had that are clinical or subclinical over a week, over a month, over a year. And you can see the pie chart on the bottom there. That's all the pathogens that the plates pick up: yeasts, prototheca, a lot of the more unusual Truparella, Pseudomonas, some of those bacteria, and then obviously your common ones as well. So the plates come wrapped. They've got a 16-week shelf life, and then you need a little incubator, and the incubator really dictates how many samples you can do at a time. So this guy does often around 20 or 30, sometimes 40 cases at a time after a herd test to keep finding his problem cows. So, it's not just about one test. It's not just about testing clinical mastitis. So this guy has, we go in and we do a lot of training. So we have these posters around managing mastitis after the spring. So we do a lot of training around that, making sure that cows don't exit the colostrum mob without being RMT or CMT, California mastitis test negative. If they are positive, there's a culture done, and those cows do not move into the clean herd. this is a biosecurity thing that I noticed in that 7-point plan, the dry cow antibiotic cure rates. It's something that as vets, when we do, say we're culturing an ear infection in a dog and we treat with antibiotics, we always go back and we make sure that that infection has cleared. It would be best practice. It's something that we don't often see in dairy practice, and we treat all these cows with dry cow, but we don't necessarily go back and make sure, because we know the cure rates are never 100%, but we don't go through and find out which of those cows have not been treated. So that's a really key part of the DairySmart program, is going in and making sure that we're looking to see what cows, what bacteria have survived dry cow treatment. And we do not want those resistant staph and streps going into the clean herd. And then obviously Medstone is testing every clinical case, and then every time they do a herd test, a milk test, they go through and culture their high cell count cows. And then one thing that they do is pre-drying off, they test every cow and only treat cows with a major pathogen present. So this is how the problem tracked. So we had a big problem in year 1. We had 300 cows, over 300 cows identified with Staph aureus. Selective culling, they couldn't get rid of all their cows they've just purchased, so they kept their year 1 to 3 cows. They selectively treated and kept some of their 4-year-olds, anything older was culled. And then in year 2, they screened all of their 900 cows before they dried off. And they identified now 100, just over 100 staph cows. And then with all of those things that I just talked about in terms of that testing right through the season, in 23-24, they found 15 staph cows in their herd. And so 24-25, we had near elimination. They had 19 Staph aureus infections over the whole season. And the pre-screening for this year, they found 3 Staph aureus cows and 3 strep cows coming into the dry period. So they've made a massive improvement in terms of infection load. But it's not all about testing, and we know that. Like just because you buy a machine and you go and test doesn't mean you're going to reduce mastitis. So introducing some of those things that have been mentioned previously today, now gloves and sleeves, that milking hygiene process every time. Paper towels, so that they use them so to avoid cross-contamination, so only putting cups on clean, dry teat. Important factor straight up to calving and in the wetter spring period. Aseptic milk sampling is a big one. So we know that if you leave it up to farmers to go and collect a sample without any training, you get all sorts of funny bugs and growing in and trying to interpret those results isn't ideal. So one thing that's come out of this is just how hygienic they are at collecting a sample now. We get these pristine samples of pure growths coming out. It's taken a couple of years. But what that is also transferred over to is when they treat a cow, they're not introducing bacteria up into the teat. They aseptically prep that teat the same as when they collect a sample. So it's had a really positive spin-off effect for cure rates. And the annual staff training and support. So DairySmart goes out and we train the farm teams, and there's several papers out there highlighting the importance of staff training and what that can do to milk hygiene. We use a lot of pictures. This is our sort of little booklet, and you can see those little pathogens up the top. That's our Staph aureus and our strep uterus. We have a lot of English as a second language, like a lot of Filipino workers working on our dairy farms, maybe the same around Europe. And the literacy rate can be a bit lower as well. So we use a lot of imagery and videos with our sort of cartoon and break it down into farmer speak. So that's all helped. You can see this drop down. These guys are running around 500 tests a month. The test costs around €11 to run. The high cell count testing, that's more like €8 because we get 2 on one plate. And so before DairySmart, you can see a bulk cell count down to now 67. They had lower counts of around 45,000. But you can see if we, like the 18% decrease in subclinical infection rate, there's big savings going back, or big money realised that would have been lost if they'd stayed at those high cell counts. The 6-week in calf rate is also, and I've got the references at the end, there's also some quite a bit in the literature showing the reproductive impacts of mastitis. But you can see now they have 182 cows calving in the first 6 weeks. Again, more milk in the vat earlier. More options around culling, and just that efficiency piece and sustainability is a big increase on that farm. The mastitis rate, significant, gone from 20% in their first year down to 4%. Again, that's a massive €53,000 on that farm that they're saving in losses. And a lot of that is those ongoing losses in production that we don't think about, that 7% loss in production for every case of mastitis. And then what's quite significant in addressing that AMR issue is you can see in the blanket treatment, they were using 5,200 tubes to treat their cows at the end of the season. Today, this month, so just last month, they used 80 tubes and the rest got TCL. So you can see there, they've just not only saved money on their antibiotics, but they also have now got, they're just addressing that resistance issue and just not contributing to resistance in the herd. So a much, much healthier herd and a happier farmer. And the other thing that I haven't mentioned there is the amount of time they've got. Like when you're only treating 4% of your herd for mastitis, they have so much more time to do better things on the farm. So the DairySmart difference, I guess, finding those pathogens hiding in low somatic cell count cows. So we do a lot of testing across the whole herd, tested every critical transition. So calving, lactation, at calving, making sure that those cows are actually cured from the dry cow you've given them. Lactation, obviously your clinical cases, but your drying off is another critical point. So that you can make decisions on what to treat those cows with rather than just using cell count alone. I've got a reference for another paper there that was published in the Journal of Dairy Research last year, comparing using cell count alone versus culture. Upgrading that shed hygiene, obviously really important, and that's that ongoing staff training and support. So please don't buy a diagnostic machine, put it on a farm and expect to get different results. It really needs all that support and that training and that education around it, and that's what I think we're pretty good at. So I've put some references there. Just if you want any more details of those, I can come and see me and I can push you towards it. But just around some of those, what's out there in the literature showing that all of this is not new, but it's, I guess, putting science into practice. So yeah, it's a relatively cost-effective machine. We have it on many farms and in vet clinics around New Zealand and across 16 countries now. And like for around €1,200, you get the plates, you get an incubator and a machine and an annual software license. So it's and then the plates you order locally. So currently they're coming across from New Zealand, but we're looking at Europe manufacture for those as well. So that's about me, I think. I don't know how much time I've got. 1 minute. So I just show you that this isn't a one-off case. This is another farm, the Balgoni farm. You can see they did a whole herd. They used a selective dry cow, 35% of their herd. They did a whole herd smart screen, so they tested every cow, low cell count cows included, and you can see the reduction of their antibiotics down to 5%, and their mastitis cases after installing a Jupiter have dropped down to 4%. This guy still goes out and tests his whole herd every season. This year he found 2 staff cows. He was really excited. He rang us. He was so excited that he had found his 2 cows, and he's not going to stop doing it. You can see the benefit in dollars to his farm. This is another one just illustrating, this is a 2,200 cow herd, 2019 doing blanket treatment. You can see that's reduced now. He treats around about 40 cows out of his 2,200 cows with dry cow antibiotics. So that's what keeps me in the game. Like, I really like that impact that we're having on driving down treatments of dry cow therapy and antibiotics in general. You can see he's now coping with around 6 to 7% mastitis, a much happier farmer and happier team and happier cows. That's me.
Thank you very much, Ben. Well, it gives an introduction to tomorrow. Do we need miracles to improve mastitis and to reduce antibiotic use? I think it's just monitor diagnostics, and that can bring us already quite a long way into another healthy world, I will say. I'm looking for Emma, or at least the boss of Emma. Then maybe you can take a bit your stuff away.
Oh, yeah. I can.
Afterwards, we will present them back so you can see them yourself.
I was trying to keep it in the show.
Yeah, but you can keep it in the show after.
No, I was joking.
We like show. So Emma made a travel this time from Switzerland to Ghent, so we are happy that she's back in Ghent. We saw her as well in 2024, but then it were the very early steps, I think. So we listen to your studies.
Oh, sorry.
Hello. So thank you very much for this opportunity to present Emma here. What's your name? Okay, and thank you to the audience for, staying with me. I know we're almost at lunchtime, so I tried to make it as short as possible and as interesting as possible. I think I have some important information to share, especially for those who really care about other health and believe in a better future, and who know that speed actually matters. Because in the end, when we were studying, we all studied for a good reason. We studied hard. We work every day very hard with extra hours because we want to improve mastitis management and some other things. And I truly believe we can get there together. I'm Sam. I'm a physician and founder of Diagnostics, and I'm going to present you Emma. I'm not a veterinarian, and I'm not an expert, but I think I can relate with you guys a lot because there is a lot of common things, common topics and common issues we need to solve. And I remember very well, those patients who showed up late, where they already had severe issues, symptoms, and they were severely sick. And I just thought it would have been very nice to diagnose that early so we would have better option to properly treat them. And this is something I truly believe. It's what I've learned in my past as a physician. Rapid and reliable diagnostics matters so we can improve healthcare. And also time is also money, and that's the other part of it. So I'm going to present Emma the 90 minutes mastitis PCR for the vet office. And why? Because happy and healthy cows produce more milk. And how are we doing this? As I said, I truly believe in rapid and reliable diagnosis as a very important first step in order to proper treatment. And by using rapid and reliable diagnostics, we can choose specific antibiotics if needed at the same time, at the same day. So we need less antibiotics, we cause less resistances. That means less mastitis cases and also healthier cows. And what is it actually, Emma? Emma is the first market-ready mastitis PCR for the vet office. A polymerase chain reaction was discovered 40 years ago. So we copy out little gene sections of the specific pathogen so you know exactly what it is within 90 minutes. And this is our concept, test and treat. Diagnose first, then choose the right antibiotic treatment if necessary. And this is super important. So you have a mastitis case, you do an MR-PCR, and at the same day, you can choose the pathogen-specific antibiotics if needed. In many, many cases, you don't actually need antibiotics. And because rapid and reliable results are available, we can really practice evidence-based antibiotic therapy and can start at the same day. So how does it work? It's actually very simple, three-step procedure. You centrifuge the milk for 5 minutes, you homogenize it for 40 seconds, so you break the cell walls, and then you put it on the device. I have one here, a PCR device, for 60 minutes, and then you have the results. On this device, you can analyze up to 8 samples at the same time. We have 2 panels available. One is the environmental and the other is the contagious one. In both panels, we have Staph and Strep species. We have Staph aureus and Strep tuberis and E. coli and an internal control, which is very important coming from a lab. And for the environmental panel, we use Klebsiella and Enterococci, whereas the contagious panel, we detect Mycoplasma and Strep agalactiae. Here's a little comparison of PCR and bacterial culture. So PCR is much faster and has higher sensitivity. We only detect bacterial DNA, so we don't grow anything. So that also means there is no biohazard. And it also means that in the PCR, we still find DNA present when there is already pre-treatment with antibiotics, which happens once in a while. We all know that. And another important advantage is that it's very easy to learn. We can teach everybody within 1 hour how to use it. And it's an automated and reproducible system, how to interpret it. So there's no wiggle room. In some cases, we have very nice feedback from our customers who were using it for more than 2 years now. And they were actually able to convince their farmers to first diagnose and then start the treatment based on the result using EMMA. And for mild and moderate mastitis cases, they were able to actually avoid antibiotics completely. For minor pathogens or gram-negative bacteria, we don't need antibiotics. In Klebsiella, they do treat. In E. coli, they don't with antibiotics. By doing so, they were able to reduce antibiotics use a lot. Here's some data from this farm. You see the red bar, super large. It's trimetox. They were actually able to reduce it from 35 liters to below 1 liter within 2 years. And ubrolexine from 1.4 liters to 700 milliliters in 2 years. In the other way, they also increased the use of ketoprofen in order to help the symptomatic process. Of course, we also have an EMMA app where everything is cloud-based, and you can start it from smartphone, tablet, laptop, or desktop. And you can do analysis by customer and cow, and you can communicate all the reports with WhatsApp or email, so that even the traveling veterinarians can, send out the reports wherever they are, whenever they want to. We now introduced a new system for QR code sample management, and we're working on other features. So that's in the pipeline. The QR code is coming right now. We just started this week. A resistance gene is also in the pipeline, BLAZ for beta-lactam resistance genes. We are also planning on introducing a smaller, more focused panel, EMMA Focus, with Mycoplasma bovis, Staph aureus and Strep agalactiae, and the respiratory panel. So in a nutshell, what is EMMA? EMMA is a real-time PCR-based assay for the detection of 7 pathogens. It's super simple. Anyone can learn it. The whole process takes up to 30 minutes. And after 90 minutes, you have the results. You can simultaneously analyze 8 samples. And we do not culture bacteria. so there is no biohazard coming from the culture. And in the end, it provides rapid and reliable results, so you can start a pathogen-specific treatment at the same day. This reduces antibiotics, lower mastitis rates, and less resistances. So if you're interested, approach us. We have a 1-month trial ongoing, so where you can test and compare whatever you are doing so far at home for 1 month and give us feedback, and most of the customers actually continue working with it. So reach out to me. I'm here today and the next 2 days as well. Thank you very much.
Thank you very much, Sam, for bringing us in contact with Emma. Do we still have a reason not to take samples now? I think we have a bit of everything. We have fast test, we have culture, we have more diagnostics, we have even antimicrobial sensitivity testing included. I think with culture, with colorimetric results. So I think we have everything now to convince our farmers. And honestly, you tomorrow in Krijntjens will also speak. She did a study on selective treatment. Honestly, I think that this might be the way to convince our farmers to take more samples for bacteriological culture. Because we are very passionate about culturing, extremely passionate about milk, but we need to be honest, it's not because they don't take a milk sample that tomorrow something very bad will happen on their farm. It's just by not doing it, never do it, that in the end you can get problems, but there are a bit more important things to do on the farm than other health, apparently. But these kind of tools, and especially also what Francisco then showed, the positive aspects of selective treatment of clinical mastitis might motivate them to take samples. And then in the end, by all the platforms you have seen, you have the data available to also prevent mastitis. We are up for lunch, yes. And then after lunch, we will prepare for the farm visit. I say, yes, you can present all of them. So if you want to touch, you want to feel, you want to open them, I don't know, they can be opened, but then just go ahead. And here you have the experts around you that can give more information about the different tests and how to use them in practice. Thank you very much and have a good taste. Yes, thank you very much.